Hello, doctor.
Hello.
Yeah, doctor, I have something quick.
Yes.
I just want to know about some few questions.
Yes.
Doctor, what is stroke?
Stroke. Thank you so much. Stroke. Briefly, what I would say, stroke is basically the cut of blood flow to the brain. That's the brief thing I would tell you. Cut of blood flow to the brain. Anything that cuts up blood flow to the brain causes a stroke. Yes.
Oh, thank you. And then, doctor, how many types of stroke do we have?
Well, basically we have two types of stroke. One is ischemic stroke and two, hemorrhagic stroke. But ischemic stroke is the least that we can see in people in the total population. Hemorrhagic stroke is the least. Ischemic stroke is the highest. About 90% of the population get ischemic stroke. Then hemorrhagic only accounts for like 10% of the population.
Okay, what's the difference, doctor?
The difference between ischemic and hemorrhagic stroke is that for ischemic stroke, it's majorly due to a blood clot. A blood clot clots in the blood vessels of the brain and cuts off the blood flow to the brain, and then a patient gets a stroke because the other part of the brain is not getting enough blood and oxygen. Whereas hemorrhagic, it's different from ischemic because it's because of the rupture of the blood vessels.
Yeah.
So when the blood vessel rupture, it causes what we call hemorrhagic stroke.
Oh, so doctor, why are you talking? Okay, why is stroke?
Stroke, it's crucial because it's one of the major causes of death worldwide and mortality in our total population. So it is very important to talk about stroke. Yeah.
Okay. Doctor, lastly, I would like to know about why should we create awareness? Why stroke awareness matters? Why is it important that we have to create awareness about stroke?
Yeah. Yes, stroke awareness is important, majorly because if people are aware about stroke, they will go for checkups. So for early detection of the risk factors that causes stroke, for example, patients will be able to know that they are diabetic
as early as possible.
Yes, because it's one of the causes of stroke in the population. People will be able to know they have high blood pressure. You know, recently we're in a scenario where you find so many people, they even don't know that they are hypertensive. So people will be able to know that they're hypertensive. Many people are obese.
Yeah.
You know? Yeah. So when they know about stroke, they will be able to know that obesity is one of the risk factors of stroke. People will be able to stop smoking because many people smoke. And we know smoking is one of the causes of stroke.
Okay, so doctor, you're saying obesity is a risk factor. What I will talk about? I would like to hear more about the risk factors.
More about the risk factors. For example, we said blood pressure, high blood pressure.
Yes.
Yes, as we said, hemorrhagic stroke is one of the strokes, the type of stroke that we have. When you have high blood pressure, it can cause rupture because of the pressure you have in the blood vessels.
Too much pressure against the blood
can cause
vessels.
Rupture of the blood vessels, and you get a hemorrhagic stroke.
Yeah.
As we said, diabetes. We know one of the causes of diabetes is cholesterol, high cholesterol. You know, in the blood vessels, you get high fat. I can say fat or cholesterol, which reduces the sensitivity of these cells to uptake the glucose because the insulin is not sensitive. So because of this cholesterol, patients will be diabetic and a lot of sugars, fats are deposited in the blood vessels, and these patients in the due course, the blood vessels will narrow. In the end, you get pressure which will lead you to get the stroke. The same with obesity, you know, and smoking predisposes you to high cholesterol in the blood vessels. So as a result, you will end up getting the stroke in the end.
Okay, doctor. Thank you for your time. I think next time I'll be coming up with the causes and more elaboration about some other few things.
You're
Okay,
welcome.
thank you. So let's meet tomorrow. I think. Thank you for it.